Good evening, everyone in Shanghai, and good morning, everyone in New York. Today, I will give you a retrospective analysis of urban transport policy and system performance during the COVID-19 in Shanghai. Shanghai is one of the most developed cities in China. The population of Shanghai has reached 24 million in 2019, and 9.76 million are permanent immigrants. Both private and public transport play an important role in Shanghai. The total length of urban roads in Shanghai is 5,500 kilometers. The number of cars has reached 5.4 million. The average daily travel volume is 57 million, and the public transport sharing is 21%. The pandemic situation in Shanghai has experienced a tortuous process. The first case was confirmed on January 20. Then the number of confirmed cases increased rapidly. Until the middle of February, the pandemic in Shanghai was well controlled. Although there were some imported cases, the whole situation in Shanghai has been basically under control in late March. Along with the COVID-19 developments in Shanghai, three main factors are supposed to simultaneously affect the social and economic operation in Shanghai, as well as the transport operation. They are the unusual human migration after the Spring Festival holidays, the reduced public life during the pandemic, and the resumption of work and production. First, the start of Spring Festival holidays coincide with the emergence of COVID-19. Here, we use Baidu Migration Index to illustrate the travel demand. The Baidu Migration Index represents the movement of population between cities, as well as the intensity of individual activity within a city. The value of index is proportional to the volume of people. According to Baidu Migration Index, migrant workers had traveled back to their hometowns before the start of travel ban on January 23rd. 3/4 of the migrant workers had not returned from their holidays as usual because of the travel ban or home-based self-quarantine. The second rush periods of Spring Festival travel season during the post-holiday periods did not occur as previous years. Second, the extended Spring Festival holidays were outbreak control closure periods for social distancing. From the perspective of urban transport, with the reduced public life came the decreasing travel demand, especially in the public transport systems. Finally, after the Spring Festival holidays, all sectors in Shanghai were striving to resume work and production in an orderly manner. However, the shortage of migrant workers, the partial resumption of work at home, and the unresolved concern of pandemic made the resumption of work and production slower than expected. From the perspective of intracity travel demand, the travel demand did not recover immediately until the whole situation in Shanghai was basically under control and the resumption of work accelerated in March. During the pandemic, in accordance with the law on the prevention and treatment of infectious diseases, the measures on the prevention and control of the COVID-19 outbreak had been taken in the transportation system of Shanghai. For example, some trans-provincial bus routes and the metro lines were temporarily suspended, and temperature checks are required at all metro stations, and masks are required in the public transportation system. As for the outbound traffic, the comprehensive inspections are required at the entry point of Shanghai, and the number of international flights are limited by the government. The traffic flow in Shanghai fell sharply since the outbreak of COVID-19. In February, the average daily ridership of Shanghai Metro was only 1/8 of the ridership in 2019. As the pandemic was under control, the metro system in Shanghai regains the trust of passengers. In July, the metro ridership has risen to almost pre-COVID-19 ridership. As for the traffic flow of expressways, highways, tunnels, and bridges, in February, the traffic flow was around half that would be normally recorded at this time of year. in July, the traffic flow gradually returned to the normal level and showed the first positive growth rate for the year so far. With the unprecedented situation and the simultaneous influence of several factors, the patterns of traffic condition variation are unknown, and determining the inherent components of variation play an important role in the traffic management as well as the pandemic control. We apply singular value decomposition algorithm to decompose the high-dimensional time series data and discover the inherent components of variation. As for the intercity travel during the COVID-19, from the cumulative migration flow before the Spring Festival, we can see that Shanghai was one of the areas with net outflows before Spring Festival. A net outflow means more people are looking to leave than to move in. It means that Shanghai should take measures to contain the spread of the virus as people return to the city from their Spring Festival holidays. According to the Baidu index, data, by February 23rd, nearly 40% of the migrant workers living in Shanghai during the pre-holiday periods have returned to work. Intercity travel demand for returning to work has not been completely released, especially for migrant workers from Hubei province and other surrounding provinces. Since there are 294 prefecture-level cities in China and 54 days in the study period, we have about 467 million OD pairs when analyzing the intercity travel during the COVID-19. So how can we extract the most meaningful information of intercity travel from the high-dimensional data? In our study, the algorithm of SVD was applied. SVD is a common method which can reflect most information of the original data through a small amount of data. We construct M. M is a matrix M. M is a spatial temporal matrix representing the variation of intercity travel demand. The spatial temporal matrix M is the collection of spatial temporal variations influenced by multiple factors. After M decomposed by SVD, the left singular matrix U reflects the variation patterns in the time dimension. The right singular matrix V reflects the variation patterns in the space dimension. The singular value is positively correlated with the explanatory importance of the components. After SVD, we can see that information expressed by the first four singular values accounts for 73% of the original matrix. Therefore, the four most important components are identified from the spatial temporal matrix based on the rank of singular values. The first principal component we identified is the stable part of the intercity travel demand. We can see from the temporal index. On January 23rd, the temporal index's UI dropped from 0.2 to 0.034. The stable part of intercity travel demand was reduced by 83% because of the COVID-19. And the second principal component is the travel demand for returning to hometowns for family reunion before Spring Festival holidays. Migrant workers travel across the country from their work or study to reunite with their families before Spring Festivals. As in previous years, the number of daily passenger trips was on the rise. Passengers basically flow from more developed urban areas to less developed rural areas. From the picture, we can see that Shanghai is one of the main origins of the travel demand of principal component 2. And the third principal component is the travel demand for returning to work after Spring Festival holidays. The progress of work resumption is gradual. Unlike previous years, several peaks of return passenger flow are discovered from the temporal curve. The direction of the intercity passenger flow is reversed after Spring Festival, and the outflow from Wuhan or Hubei province is barely detected. The last principal component is the travel demand for returning to hometowns to avoid rush periods. In Yangtze River Delta urban agglomeration, and Shanghai is one of the cities in Yangtze River Delta urban agglomeration, and Pearl River Delta urban agglomeration. Some of the migrant workers return early to hometowns to avoid the peak travel season. And on the other side, migrant workers in some provincial capitals return to their hometowns just on Lunar New Year's Eve. From the four principal components identified from the spatial temporal matrix of intercity travel OD, we can see that we can find that the stable part of intercity travel demand was greatly affected by the COVID-19. During the pre-holiday periods, the number of daily passenger trips was on the rise until more confirmed cases of COVID-19 were reported, and the human-to-human transmission of the virus was confirmed by the China's National Health Commission. By early March, there were still plenty that haven't made return trips. The travel demand of returning to work has not been completely released. Shanghai, as a main destination of return trips, the epidemic prevention and control measures, as well as the transportation support, should continue to be taken seriously. As for intercity travel, the overall trend of traffic condition during the pandemic was analyzed in our study. The average speeds of TAZs in the different time periods during the first, second, and fifth week of work resumption are compared with that of the set baseline. The speed change rates in the morning peak, evening peak, and off-peak are calculated and illustrated respectively. The overall traffic conditions were improved obviously under the dual effect of the long holidays and the pandemic. However, as the population returned, the average speeds gradually declined to the baseline. The recovery of traffic performance in the morning peak and evening peak are more evident than that in the off-peak. It indicates that the travel demand of commuters returned to the normal level more quickly. It should be noted that compared to the baseline, the average speeds of a few TAZs in the far suburb are colored in red. It was the consequences of the comprehensive inspections at the entry points of Shanghai. All vehicles entering Shanghai was subjected to a comprehensive inspection as part of measures to contain the spread of the virus after the Spring Festival holidays. SVD is also applied to explain the spatial temporal variation of traffic conditions during the pandemic. After SVD, the information is expressed by the first three single values accounts for 60.2% of the original matrix. Therefore, the three most important components are identified from the spatial temporal matrix based on the rank of singular values. The first principal component is also the stable part of the variation. We can see that average speed has a significant increase after the start of Spring Festival holidays and the combined influence of the travel restriction policy for the pandemic and moving out people for the Spring Festival. The temporal curve does not show evident peaks or troughs. With the advance of work resumption, the curves gradually approach the blue one in the peak hours and have no significant change in the off-peaks. There is no significant difference in the spatial distribution. The second principal component is the variation affected by commuting. The temporal curves show evident peaks in the commuting hours. With the advance of work resumption, the curves gradually approach the blue one in the peak hours. However, no significant change can be found in the off-peaks. The TAZ is located within the outer ring road and along the expressways are in warm colors. Since the spatial curves of these TAZs fluctuate towards the opposite direction of temporal curves, the average speed in these TAZs significantly decrease in the peak hours. On the contrary, the average speeds increase in the TAZs in the outskirts of the urban areas in the morning and evening peak. This principal component shows that people reduce the travel demand in addition to the necessary commuting needs. The third principal component is the variation affected by migrant population and work resumption in some TAZ. This part of variation is only significant in particular periods of days between January 23rd and March. TAZ with sharp decline of average speeds mainly located in the city center and near the entry points of Shanghai. Firstly, the unresolved concern of pandemic forces more people to return to private cars as their preferred mode of transportation. Secondly, restrictions on travel have weakened, so the amount of motorized travel increased. What's more, it was the consequences of the comprehensive inspections at the entry points for all vehicles entering Shanghai. From the three principal components identified from the spatial temporal variation, we can conclude that the travel demand in Shanghai is reduced due to the combined effect of the pandemic and the holiday. The average speed of most TAZ increases obviously. With advance of the work resumption, the traffic operation gradually returns to the normal level. The recovery of the variation pattern is more evident in the peak hours than that in the off-peak hours. It is important to dynamically understand the urban traffic operation in the complicated context of pandemic outbreak. Some traffic control strategies should be taken in particular TAZ and time periods to prevent congestions. This is all my presentation today. Thank you for your listening.
Thank you.
Thank you, Professor Lee. So we have some time for if anyone has any questions. If you're a panelist, you should be able to unmute yourself and ask your question directly. If you are an attendee and you have a question, please use the raise hand function or the Q&A function if you want to ask a question to Professor Lee.
I have a quick question for Professor Lee. So when you say the traffic is gradually returning to normal, how far away from the normal? Is it like 80%, 90%, or so?
For the ridership of Shanghai Metro, in July, the ridership returns to the 80% of that in 2019.
Okay.
And for the intercity travel demand in Shanghai, in late March, it almost returned to the normal level as that in 2019.
So the car traffic is like more normal than the subway. Is that what we can say? So there's still some percent people are not. Okay, all right. That's good.
So Dr. I would like to explain these questions maybe in short sentences.
Sure.
Actually, the most significant change in Shanghai is there are more and more people they choose to drive cars. And also, you know, in Shanghai the car plate is by bid. So the government control the number of car plates. After the pandemic, because they want to stimulate the economy, so they increased the number of the car plates.
Okay.
So usually we have, I think we have 120,000 per year for the increased car plates. So they increased actual 40,000. So it's like 30%.
Okay.
So a lot of people, they buy the cars. And in the presentation, we didn't show you the regular bus. So the transit is become to recovery, like 90%, 95%. But for the regular bus, it is only like 60%.
I see.
I think this is a disaster for us, especially for the like a sustainable travel behavior.
Yes.
Like a regular bus. So nobody would like to choose the regular bus. But for the transit, it's because they have to take the transit because the long distance is convenient. But more and more people they change to the private cars, and they make the road congestion pattern changed. Actually, this is only part of the work. We continue to do this thing to monitoring all the road congestions in Shanghai. So
I think this is important, I mean, for both like New York City and Shanghai, because we would like to know how permanent is that shift. You know, are people going to continue to use their car, or are they going to go back to subway or bus? So for New York also, this is a major concern, and we don't know. So so this is it's good to see, and I think Shanghai is at least few months ahead of New York City in terms of recovery. So it's a good kind of like a predictive thing to see, like what happens in Shanghai versus what we expect to see in New York City. So thank you for your explanation. All right.
Let's move on to our next presentation. It's by Jiamei Liao and Ying Hui from Tongji, and it is titled Behavior and Intention of Using Shared bicycles during the epidemic. So whoever is going to be presenting from your side, please take control of the screen.
I think it's Jiamei, right?
Oh, yes.
Go ahead.
Good morning, everyone in New York, and good evening, everyone in Shanghai. I'm honored to have this opportunity to speak at this meeting. Today, I would like to present my paper, Behavior and Intention of Using Sharing Bike During the Epidemic. My presentation will cover the following aspects: research background, questionnaire survey, data analysis suggestions, and the summary of the research. In the first part of the report, I'm going to begin with the research background. In early 2020, novel coronavirus pneumonia outbreak caused a large reduction in total travel volume. However, basic travel demand, such as daily purchasing, still existed, and commuting travel demand was gradually recovering. Great changes have also taken place in urban transportation supply. Rail transit and conventional bus, which undertook the task of medium and long-distance passenger transport before the epidemic. However, during the epidemic period, due to the confined space and the mixed flow of people's confidence in their safety was reduced, and their passenger carrying capacity was limited by these prevention measures. A large number of passenger transport needs are transferred to private transport, but not all of them can be met. In order to meet people's travel needs and improve their travel quality in a special period, we can't completely rely on private transportation. We should fully tap the potential of other public transport modes. The sharing rate of sharing bike increased significantly during the epidemic period. It has high accessibility and availability, relatively low cost and virus infection risk, and scheduling is easy to achieve. Therefore, in response to public health emergencies and other situations, the city can guarantee a certain sharing bike ownership rate and use intensity, and formulate an adjustment plan in special period as the basic disaster prevention measures. The second part is a questionnaire survey to collect data. The content of the questionnaire is divided into 4 parts, namely the social and economic characteristics of the public, traffic control measures in the city, travel intention and behavior before and during the epidemic. The questionnaire was distributed through the Wenjuanxin platform, and 882 valid answers were collected from March 3rd to March 8th, 2020. The results of reliability tests show that the reliability quality of the data is very high, which can be used for further analysis. The third part is the analysis of the obtained data. By comparing the use characteristics of bike sharing before and during the epidemic, we found that the role of bike sharing in urban transportation system has changed. Before the outbreak, 46% and 18.4% of the travelers use buses and rail transit as the main means of transportation. During the epidemic period, shared bicycles take part of the passing transport tasks of buses and rail transit, and are more used in medium and long distance travel. Before the outbreak of the epidemic, the number of trips using shared bicycles during the whole travel was slightly less than that using shared bicycles to connect with other modes of transportation. However, during the epidemic, the proportion of fuel use increased to 75.1%, which was significantly higher than that of connection. This shows that during the epidemic period, the main function of bike sharing is no longer to solve the last mile travel, but to undertake a complete travel task. Before the epidemic, 35.9% of the respondents regarded commuting as their main purpose. During the epidemic, 93.1% of the respondents used shared bicycles for commuting. On the one hand, the epidemic situation has led to a sharp reduction in non-rigid travel demand. On the other hand, the reduction of public transport system services has led to inconvenience for people without cars. Therefore, in the early stage of returning to work and production, bike sharing has become one of the main modes of transportation for those who need commuting. Before and during the epidemic, the main motivations for people to use shared bicycles are almost the same. However, among the main obstacles, there are two new factors, namely no travel demand and the view that sharing bicycles are susceptible to disease. Affected by the novel coronavirus pneumonia, some areas have adopted close control policies, such as restricting access to residential areas, suspending the public facilities or opening time limits, and to a certain extent, have restrained residents' travel demand. The property of sharing of shared bicycles leads to indirect contact between users, which has a certain risk of virus transmission and weakens travelers' intention of choosing bike sharing. The questionnaire survey set up 5 measures to encourage people to use bike sharing in necessary travel during the epidemic period, and investigate the degree of people's recognition of these measures. Then give weight to the degree of recognition of each level and calculate the score of each measure. They can be seen from the calculation results that reasonable disinfection of bike sharing service facilities, scientific layout of bike sharing drop points, and more safe and comfortable riding environment can effectively improve people's intention to use bike sharing during the epidemic. Then establish a cross table and subdivide the main groups affected by various incentive measures. Women, middle-aged, and young people, people with high education, and those who have gone out to work generally have a deep understanding of mechanisms of epidemic spread, worry about virus infection, and pay close attention to environmental sanitation. Therefore, reasonable disinfection measures can significantly improve the intention of these groups to choose bike sharing. Compared with young and middle-aged people, the elderly tend to be more sensitive and trust in government and media propaganda. The improvement of bike sharing service in all aspects can make bike sharing more advantageous in the choice of transportation mode for those who use bike sharing as the main mode of transportation during the epidemic. Selecting independent variables from 3 aspects of users' personal attributes, attitude, and control measures, using the frequency of commuting and non-commuting travel as dependent variables respectively. 2 multiple logistic regression models were established. After several adjustments and optimization, the 2 models passed the likelihood ratio test at a 0.0 significance level, and the prediction accuracy reached 85.9% and 89.6% respectively. The following conclusions can be obtained by analyzing the calibration results of the model parameters. Gender, age, education, and occupation have no significant influence during the spatial period. The return to work status of the public has a certain impact on the frequency of bike sharing during the epidemic. Compared with those who have not been required to go out to work, those who have returned to work will return to work are more likely to use shared bicycles. Moreover, the higher the frequency of going out caused by return to work, the greater the intensity of bike sharing. This shows that bike sharing, at a low cost, easy to use, and less affected by the epidemic, plays an important role in commuting during the epidemic. When people agree on the economy, convenience, and the safety of bike sharing, shared bicycles will be used more during the epidemic. People who are more worried about the epidemic situation are more likely to choose bike sharing during commuting. The higher the degree of support for promoting bike sharing during the epidemic, the higher the frequency of bike sharing in non-commuting travel. During the epidemic period, the city's restrictions on other modes of transportation will affect the commuting frequency of shared bicycles, while the control degree of residential areas is the main influence factor of non-commuting frequency. Then take never use, use occasionally, use frequently as references respectively. The factors that attract new users and increase the use intensity of regular users can be found. Taking the two basic usage features of using distance and usage mode as indicators, three use modes are defined by cluster analysis, which are full use of medium and long distance, convection use of short distance, full use of short distance. Then establish cross table to summarize the group characteristics of different usage modes. It can be found that the age of users has a great influence on the choice of sharing bikes usage modes during the epidemic. Those who are 30 years old and above may have more commuting demand, so the riding distance is relatively long. 18 to 30-year-old groups may mainly use shared bicycles as non-commuting travel vehicles, so the riding distance is generally shorter. When people have strong environmental awareness or the urban land structure is more reasonable, people choose the full use more likely. When people have less tolerance for traffic jam or the traffic congestion is serious in cities, it is more likely that people choose to use shared bicycles to complete the long and medium distance travel. Limiting the way of transportation outside shared bicycles will make travelers change from connection use to full use. Based on the intention and feature mentioned above, put forward suggestions for the spatial period related to bike sharing. During the epidemic period, bike sharing is mainly used in the whole process of travel and is one of the main commuting tools. Therefore, in the places where bus and rail transit transfer with shared bicycles, the number of bikes should be appropriately reduced, and the number should be increased at the end of the travel chain, especially in the office area. People's travel scope during the epidemic is relatively fixed, and they tend to solve various basic needs within or near the 15 million community life circle. Bike sharing can improve the traffic convenience and accessibility inside and around the living circle. Therefore, in a single community and in the vicinity of various facilities shared by multiple communities, more shared bicycles should be put into use, and the mode of multi-point small number should be adopted. According to people's recognition of various incentive measures, 77.7% of the respondents would increase the frequency of using shared bicycles because of safer and more comfortable riding environments during the epidemic. According to the distribution of shared bicycle use time and distance, the demand for medium and long distance riding increased significantly during the epidemic, which required more time and physical strength. Therefore, in order to attract travelers to increase the use of bike sharing, it is necessary to enhance riding comfort and improve the service quality of bike sharing. Specific measures can be divided into two aspects. The main obstacles to the use of bike sharing during the epidemic period included the belief that it's easy to get infected when you use bike sharing. In the duration of public health events, exposure risk is one of the main factors affecting travel decision. Therefore, under the premise of ensuring health and safety, travelers' perception of exposure risk of bike sharing should be reduced. That is to say, the public's trust in bike sharing in public health and safety should be enhanced. Different measures can be taken for different age groups. Finally, the main conclusion of this study. That's all for my presentation. Thank you for listening.
Thank you, Jianmei. Anyone have any questions? If you're a panelist, feel free to ask your question directly. If you're an attendee, you can raise your hand and we can unmute you. Okay, thank you for your presentation. I think we're rolling right along here on schedule. So our next presentation is, now we're going to shift from Shanghai to New York. So we're going to talk a little bit about some of the things that have been happening here in New York City as far as impacts from the pandemic go, and then what our work to kind of address it. So our first presentation is going to be on the impact of the COVID-19 behavioral inertia and reopening strategies for New York City transit. So that's our public transportation system. And it's going to be presented by Professor Joseph Chow of New York University and Ding Wang, a PhD student here at C2 Smart Center. Go ahead, Joe and Ding.
Yeah, thanks, Sri. So yeah, good morning and good evening to everyone. I will mostly let Ding to give the presentation. John, I think this is being set on some presentation, like the presentation mode is not showing the full screen.
Yeah, I think this is Ding's presentation. Ding, can you switch to full screen mode for your presentation instead of presenter view?
Yeah.
Okay. I think I'm on the, you can't see my screen?
Yeah,
but it's showing it as with a preview of the next slide.
Oh, sorry. Let me stop share this and try again.
Yeah. So while she's setting that up, yeah, now that looks.
Is this right now?
That was good. Yep.
Perfect.
Okay.
Yeah. So just I wanted to introduce the project as it's related to another project that we've been developing at C2 Smart for the last 2 years. When this COVID started in New York City, we had just completed development of this citywide virtual testbed for New York to be used to evaluate the impacts of different either emerging technologies or policies, or looking at impacts of large-scale shifts in the behavior of the population. So with this scenario of COVID happening, we felt that it would be a good opportunity for us to make use of this virtual testbed to evaluate the impacts of COVID and to make use of that simulation to evaluate policies moving forward. This testbed is based on multi-agent simulation, which Ding will talk about, and we had calibrated the model using pre-COVID data, and the biggest challenge here was to try to take that existing model that we developed and to modify that to reflect the conditions that we saw during COVID in those initial couple of months, so that it captured properly the behavior of the travelers. And so the behavior inertia here that we're talking about is basically, as we started seeing reopening in the subsequent months, the behavior of travelers still, we assume, if they were to exhibit the same kind of behavior that they were exhibiting during the core COVID shutdown period, what would be the impact on the reopening strategies for New York City transit? So that's the kind of like the main background behind this this research. And Ding, you can just get started with this.
Thanks, Professor Chao. Hello, everyone. My name is Ding Wang. I'm a PhD student at C2 Smart Center. So today I will talk about our work, the impact of COVID-19 behavioral inertia on reopening strategies for New York City transit. This work is with Professor Chao, Professor Osby, and Dr. Brian He, Dr. Jenny Goh, and also Shui Lier. So we know that New York City is a national epicenter a few months ago. So to flatten the curve, New York has shut down many businesses and require people to practice social distancing. Well, even with the reopening in the last few months, transit ridership still remains low, even there's no evidence of transit being a super spreader. So there's a few research questions that we mainly focus on. Firstly, it is likely that people are shifting from transit to other traffic modes. So what is the impact of COVID on people's mode preference? Then we know that with the behavioral inertia from COVID-19, what is going to impact on the traffic congestion in the reopening scenarios? And also with the social distancing requirement, transit capacity will be impacted. Then how this reduced capacity combined with the change in mode preference will impact on the transport system. We have an existing simulation model built for New York City using an agent-based simulation platform, MASSIM. We call this MASSIM NYC model. Then we propose to recalibrate the parameters of mode choice model using data from COVID time to obtain a new model that is designed for COVID time. We call this MASSIM NYC COVID model. Then we will use this MASSIM NYC COVID model to analyze the reopening scenarios to help us get some insights on how behavioral inertia and the different transit operations will impact the transport. So I will use a few slides to introduce our MASSIM NYC model. So MASSIM is very good at capturing traffic dynamics and travel activities that can be used to evaluate different policies on the different scenarios, such as some work in the literature that deal with car sharing and the most recent mobility as a service study. So our MASSIM NYC model has about 8.3 million agents. The transit schedule is from MTA data and considers the time constraints. So we only run a 4% sample population. Each scenario takes about half day. The mode choice model is estimated by using regional household travel survey data and American community survey data. We have totally 8 traffic modes in our model. Well, to validate the MASSIM NYC model, we use the 2017 citywide mobility survey data to compare with the predicted value. And the result shows that the model is actually very close to the survey data. Then we also compare the daily transit ridership data of subway stations. We select some basic, very popular stations in New York City, and the result found that the difference is in average 8%. For the traffic network, we also compared the media difference between simulated traffic volumes and real traffic count data, which is 29%. So these are actually acceptable for a citywide large-scale simulation. Then let's talk about the MASSIM NYC COVID model. So the population during COVID time was estimated by the teleworkable population in each industry. This is based on a recent study by Dingo and Niemann. They have estimated the teleworkable rate in each industry. And then we use the traffic data from COVID time, mainly from MTA data and the Apple Mobility Report. We have used this traffic data to calibrate the mode choice model. So after the model has been calibrated, the average difference of trip reduction compared to the observed data is 9%, which is acceptable for our threshold. So the parameters from the calibrated mode choice model shows us that transit mode share has decreased while driving, walking, and biking has all increased. And the driving increased more in non-Manhattan regions than in Manhattan. This kind of makes sense because many people in Manhattan, they don't have cars. So then we validated our model use the transit turnstile data. The 10 most busy stations are compared, and the total difference is around 2%, while the absolute average difference, I think it's about 18%, which are acceptable for this kind of large-scale simulation. So after we have calibrated our models, then we can compare the traffic congestion in pre-COVID model and in COVID model. So in this map, you see that more green means traffic is better, and yellow and red means there's a certain level of congestion. So we can see that because COVID-19 has made a lot of people stay at home, so the reduction of trips makes the traffic looks much better. But we know as the city reopens, the commute traffic will be back. So as well as the traffic congestion. Then we want to know if we assume people have behavior inertia from COVID time, what will be like, what traffic will be like in the reopening scenarios. So we have designed two scenarios for reopening, two scenario set for reopening. Scenario set 1 with no transit capacity restriction, and scenario 2 with 50 transit capacity restriction, because we want to say how this different transit capacity restriction will have impact on the transport system. So there's some result in scenario set 1 with transit operator at full capacity. We assumed the city will fully reopen at phase 4. So we found that the result shows the car traffic is expected to increase up to 42% compared to pre-COVID level. And transit will be 73% of pre-COVID level. And taxi for hire vehicles remains low. Then if we assume transit operator at 50% capacity, we found that this will not push more trips to car mode. We only found 1 percentage point increase in car mode, while transit further decreased from 73% to 64% of pre-COVID time. And we also found that micro mobility jumps significantly, such as bike and city bike. Okay, this is a time of day distribution of speed and volume at citywide and Manhattan. The traffic impact in Manhattan is found to be larger than citywide because traffic is already very congested in Manhattan. So we have some policy suggestions here. So we saw that car trip ratio will increase. So congestion management policies like condo pricing can be implemented to deal with traffic congestion by mode changes. And we also found that micro mobility increased significantly. So planning ahead for micro mobility, which can be used as a substitute for transit users. I also want to use one slide to talk about, because this research is about 3 or 4 months ago, so we have more data about the reopening right now. We are continuing to monitor the traffic data in reopening, and the VMT in July and August is found to be close to our prediction. The VMT observed data of VMT is from straight line data, and the difference is only 6%. So this is very pretty close to the real data. And the predicted trip ratio and trip ratio of transit and car are slightly higher than the observed data. So we think that because NYC is still not fully reopened yet, even we are at phase 4 right now, but some industries and also some schools and universities are still not fully reopened. So this might impact on the result. So we have to continue to monitor the traffic data in the next few months. Okay, so few about next steps. We are continue to work on the COVID-related studies for post-pandemic, and we are also collaborating with Canal team to look at the emission set in post-pandemic, because it's likely that if traffic congestion becomes worse, the traffic emission will also becomes worse, which will have impact on which will have impact on the public health. So I also have some links here. Feel free to read our paper, and also you can check out our website. Also, if you are interested in this work, you can feel free to email me. Sure, that's all about my presentation. I will end this.
Great. Thank you, Ding. That was very good. Any questions for Ding or Professor Chow from anyone before we move on? Otherwise, I think we'll have some time after the next 2 presentations to have some discussion as well, so we can be more interactive then.
Hi, Sherry, I have
Go ahead.
a quick question. Actually, we did a similar thing in Shanghai, so we want to build a massive in Shanghai, similar like a massive in New York City. Maybe later on we can collaborate together to do some work, because I saw it's well established, right? The massive in New York City.
Yeah. I think.
Yeah, actually, we did a very similar thing. Use the massive to like to do the various spreads. I found that the tricky part for this work is about the travel behavior changes, the mechanism. So can you explain more detail about how the survey? Do you do any surveys about all this thing?
Right now we didn't use any survey data to calibrate the model. Basically, we have a well-calibrated massive for regular time, and we collect some traffic data during COVID time. We collect the transit ridership reduction data, and some data from Apple Mobility report. They provide the car trip reduction, transit reduction, and work trip reduction. So we use this data to calibrate the mode choice model. So in this way, that the mode choice model will fit the people's travel behavior in COVID time. So this kind of represents the travel behavior shift.
Okay, I understand, because in the United States, the survey is a long process. It's not like in China, we put online and we get the data. So do you have any plans in the future to all the New York City that the officials do like a survey on this?
Yeah. So actually, we have a presentation coming up that's on a specific small survey that we did ourselves, which we'll talk about. But I mean, your point is well taken. I think in terms of data collection, it's not super straightforward here, and
yes.
Maybe it's more difficult here. So that's why kind of I think our work is we're looking more at finding supplemental data sources and other ways to do measuring in terms of modeling and predictivity. So yeah, it's more of a challenge here maybe than perhaps for you. So
yeah.
And on your first point regarding MatSim and MatSim Shanghai, I think so. This is work that our team, led by Professor Chow and Professor Osbe, has been doing for 3 to 4 years now. So in terms of MatSim model development in New York City, even this presentation was about its applicability to the COVID-19 pandemic, but we have much larger focus and goals with that model. So one of the things that we're definitely trying to do is connect it with models in other cities, because I mean, first of all, it's open source technology. We can kind of share and iterate and learn from each other as well. So that's something that I think maybe offline, Professor Chow and you can discuss on how to work together on that.
Yes, I think it's very interesting to compare with like New York and Shanghai, is both metropolitan, so maybe different behavior and model something. Yeah.
Yeah, it would be ideal because we would be using the same type of platform, and then we can evaluate different policies and technologies across different cities. So yeah.
And Professor Cho, and I think in Shanghai, we have more data than New York City, so probably we can do better for the modeling about the vaccine.
Sure. Yeah. That would be great. Let's follow up after this.
Okay. All right.
All right. Great. So
I think let me just say one thing, and we didn't have a chance to discuss that with Joe, but I think we had an email exchange. I think there is a new small and quick NSF call for this international collaboration for this kind of work that's being discussed. So I think this might be one of the ideas of collaborating with New York and Shanghai, and NSF is looking kind of, warm to this kind of collaboration. So maybe that might be one of the things that we can discuss offline. There's a dear colleague letter from NSF that they are looking for this kind of thing. So let's keep that in mind. So if there's we're writing minutes, let's have this as a note, and then we can use that as a follow-up.
Yeah. Sounds good.
Yes, I'm very glad to do that too. Yeah.
Okay, great. So let's move on, and I think in the New York section of the program, kind of what Ding covered was sort of what was going on, what we were doing during the height of the pandemic to do kind of predictive analytics and behavior. And then as that was going on and kind of wrapping up around the end of summer, our colleague Sarah Kaufman from the NYU's Rudin Center for Transportation, our close partners, was conducting a study looking at the overall kind of significant impacts of COVID on transportation systems throughout New York City. So they put together a comprehensive study and a report, and we asked Sarah to be here today to share some of the key findings from her work and their work on what happened in New York City, kind of in a retrospective. So with that, Sarah, why don't you take over and share your screen?
Sure. Thank you for having me here. Let me just get to the presentation. Great. You can see my screen? Great. Okay, so as Sri mentioned, I'm Sarah Kaufman. I'm with the Rudin Center for Transportation, a close partner with C2 Smart. And we did a report together with a company called Sam Schwartz Engineering to look at every aspect of transportation during coronavirus. We put out the report in July, so the data covers basically February to June of 2020 in New York City, which was really the height of the pandemic locally, or at least the first wave. So I put at the bottom of the slide, you can see the bit.ly link if you want to go directly to the report, or you can go to the NYU Rudin Center website to see more about it. So I'm going to share some highlights, although the report itself is rather long, and I'm happy to answer questions, but I'll get into what we found. First of all, we found that that subway ridership really seriously declined, but as you can see, it declined the most in Manhattan. And that is the complete shutdown of offices between February and April. And in Midtown Manhattan, which is a commercial office center, it declined as much as 96%. It stayed, it didn't decline as much in places like the Bronx, because the Bronx has several neighborhoods full of essential workers, which I will show you a map of shortly. But basically, the subway ridership continued among essential workers and not evenly across the city. Here you can see a map that shows where essential workers live in the darker shaded areas. These, and locally essential workers are defined as people who work in the healthcare, mail and package sorting sectors, food preparation and delivery, as well as cleaning. Those are just some of the functions. And so New York City has about 1 million essential workers in its workforce. So you can see the neighborhoods where they tend to live. I'm not sure how familiar you are with the geography of New York City, but this long stretch is Manhattan. And here in Upper Manhattan, we have a concentration, which is Inwood and Washington Heights. This is the Bronx. And these two neighborhoods especially include about 3 major hospitals. This area in Queens, as well as this one, include major airports. So the airport workers were also considered essential. And as well as this lower part of Brooklyn here, which includes hospitals and several kind of other essential worker functions. So you can see the dots on the map indicate our subway system, and each dot is a subway station. And so we looked at how much usage of the subway declined during the pandemic. So the big summary of this map is that essential workers still very much relied on the subway. Overnight, the subway began to be shut down between 1 and 5 a.m. Typically, it's a 24-hour system, but it was shut down during those hours because there were only about 10,000 riders during that time, which is a far lower number than on a typical night. And so in lieu of offering transit service, the MTA, the Transit Authority, offered rides, basically funded Uber and Lyft rides to these essential workers who would have to take a bus that would be longer than 70 minutes. Although that program has ended, the subway is still not back up to 24-hour service, and that's mostly because of a funding issue. So you can see how these modes kind of shifted during the pandemic. What I think is most interesting is this kind of reddish pink line that shows City Bike, which is our bike share system. And City Bike bounced back pretty quickly and continues to bounce back. In September, they set a record for the most City Bike trips ever in a month. There were 2.5 million trips in September, which is a really large number for a system with that isn't fully covering New York City yet. But people are taking bikes in large numbers now because of a belief that it is a socially distant form of commuting or getting around. And there is fear of the transit system at the moment. We are seeing an increase in cars, which I believe Ding was referring to. And subway ridership is increasing. Now it's at about 30% of the ridership levels from last year, but it's still not close to what it was, obviously. So the bigger story here is the micromobility increase in throughout the city, both in terms of City Bike and in personal bike ridership and in scooter usage as well. We have a new shared moped service called Revel, and it's relatively new. It's about 15 months old, and that grew massively in popularity as well during the spring. So the report includes several recommendations. I'll just highlight a couple of them. The first is to reconsider the curb. Right now, our curb space is primarily used for parking. And so the recommendation here is to reconsider what we use our curbs for in terms of more dynamic uses, such as taxi pickup and drop off and delivery zones for package deliveries from Amazon, for example. And in general, using our curb space for active uses rather than static parking for 20 hours at a time. Another is to expand the transportation system basically through micromobility because as I mentioned, City Bike, Rebel, and other modes are becoming so popular. And we have had success of what are called open streets, basically streets closed to cars, but open to pedestrians and cyclists. Those have been extremely successful. And so the recommendation here is to continue that, as well as connect these micromobility modes. And we will have e-scooters coming in the spring to connect these modes to transit so that we have a really productive last mile solution. The final recommendation is also in terms of encouraging micromobility, but expanding the offerings. So City Bike only covers about 60% of the city at this point. And so the recommendation is to expand it, as well as expand the offerings of Revel, the moped service, and introduce e-scooters, which should happen in the spring. So those are just some highlights. You can see the website here where you can read and download the report. And I'm happy to answer any questions you may have.
Thank you, Sarah. So yes, if anyone has any questions or follow-up comments, if you're a panelist, please feel free to unmute yourself and chime in. If you're an attendee, you can use the raise hand function.
I have a question for Sarah, just a quick question. So Sarah, I mean, you have a different vision than engineers. Where do you see this crisis in transit going? Is it I mean, do we have to wait for a vaccine, or even after a vaccine, are we going to see some effects of what Tongji friends discussed, like people buying more cars, moving to non-transit modes? I mean, do you have any insights on that? Any thoughts?
Sure, I have some assumptions, but it's hard to know for certain, of course. I do think that we will see transit funding from the federal government, probably not at the levels we're requesting, but because New York workers power a good percentage of the major corporations in this country. It is in the federal government's best interest to fund transit so that these companies can continue operating, which is a major economic driver for the country. I do think that in terms of car purchases, we will see a growth. We are seeing a growth of car purchases, obviously, but at some point, the simple geography of Manhattan that cannot fit more cars will kick in, and people will just simply not be able to travel anymore by car. We are seeing a growth of bikes and micromobility, which is clearly needing to be accommodated. Right now, cycling in the city is not especially safe, but we are seeing about a doubling of number of cyclists and an increased diversification of cyclists. In the past has been, it has tended to be kind of younger men, and now it's diversifying in age and gender.
Yeah, I mean, one anecdotal thing, we see the housing demand for suburbs growing and people moving out of Manhattan, for example. I don't know if it's the same thing for Shanghai. And I mean, it's wishful thinking. Maybe the housing prices in big cities like New York and Shanghai maybe will come down a little bit so that people can afford more housing, so that might have some positive impact. Because I don't think the demand is only for a certain kind of people. So if the prices go down, I think other people will come in and, replace people who can afford more expensive housing. So, but that will be interesting to see if there's similar trends in other places like Shanghai, and how long this will continue. Because of course, when people buy houses, it's a long-term investment, so they're not going to come back to the city. So that's kind of a side effect of what's going on, I guess, beyond transportation, because some people do not feel living in the city or commuting to the city. So we might see some trend.
Yes, I agree.
All right.
As for Shanghai, I think it's impossible to change the houses. It's too expensive.
Okay. But I mean, is there a trend, people trying to move outside Shanghai because of the COVID situation? I mean, I don't know. The Chinese, obviously, housing is different. So, I mean, is there some population that says enough is enough? I don't want to live in Shanghai. I want to live outside Shanghai because it's, I mean, too crowded and too dangerous.
Maybe what you're saying is maybe not outside Shanghai, but because it's so large, the area, maybe outside the inner ring.
Yes. I mean, whatever. I mean, so, and of course, even many countries like Turkey and Shanghai, the suburban housing that exists here, it's not the same. I mean, even if you go outside, you live in apartments and kind of more dense areas. So
I think
I think the rich people may buy like a vacation house. That's possible, but for the like normal families, because in Chinese the culture is different. So the Chinese, they live for the next generations. It's about the kids' education and other things. So they won't change. I think in Shanghai also, because of the high price of the house, it's impossible for now. It's very difficult for like a family to change the house. Yeah.
I think the other thing is because, you know, the situation in Shanghai is most of the positive cases, they're kind of like imported cases. So people actually, you know, usually these are the cases from like international air flight from other countries right now. So I feel like people also has less concern and less worries, you know, compared to New York City. Like over here, people are more, you know, concerned about like getting the virus. In Shanghai, it's more like, as long as you have protected and you don't really go to the airport that much, it seems like okay there.
Okay.
Yeah.
Okay. Yeah.
Interesting. I mean, again, every country has their own different housing dynamics, family dynamics. I mean, socioeconomic dynamics. So, which is interesting also to compare those. And there's something to learn from each other. So, I mean, one thing that we are hearing, I mean, as Jenny's saying, many of the Asian countries, they feel like if they wear the mask and they keep the social distancing, they're safe. So it's different than some other places. So I think, so it's important. Okay, so I think if there are no other questions.
All right, thank you, Sarah.
Thank you
for your presentation. And then again, during if we have follow-up discussions either during the break or during the discussion section afterwards, we can continue this discussion. So if not, I'll move on to our next presentation. So I mentioned kind of the first presentation was predictive. This presentation was kind of a view on what actually happened. And then next we'll have Dr. Jinchun Gao and Abhinav Bhattacharya, a PhD student here at C2 Smart Center, look at a survey or share with you some of the results of a survey we conducted here in New York and elsewhere on to give some insights on what might happen kind of going forward. So I will turn it over to Abhi and Jenny.
Thank you, Shri. Hi, everyone. I'm Jinqing Gao. You can also call me Jenny. I'm a postdoctoral associate at C2 Smart Center. And we also have, as Shri introduced, Abhinav, who is a PhD student and research assistant at the center. And today we're going to introduce a survey that we conducted in the past 4 months on the post-pandemic trend in New York City. And this is a joint effort of me, Shri, RB, Dr. Asbey, and also with the support from Sarah, NYU Rudin Center of Transportation. So first of all, the motivation of the survey is really straightforward. You know, the pandemic kind of like reshaped the travel trend, the travel behavior of people. And we're interested in understanding how people are adjusting their travel and essential needs. Specifically, we're also looking at how different demographics of people were affected and what is the impact on disadvantaged groups, including people with disabilities, women, older people, and also low-income households. Next slide. So over the last 4 months, from July to October, we collected about 1,800 responses from residents. And this is the overall, not only New York City, from the residents in US. And out of this 1,800, we have about like 1,000 completed responses. And the data were mainly collected through organic reach, including social media, including email, outreach, and newsletters. and the data from people with disabilities and also older people are mainly collected through Qualtrics panel. And we have about like 28% of the respondents identify themselves as living with disability. And we have about, I think like 100 are people like age over 60. So just giving an overview of the demographic of the respondents, over the age groups, I think we have a decent sample of like different age groups. And out of these, like 38% are female respondents. For the annual household income, I think our sample a little bit skewed towards the relative high income. This is mainly because the 500 respondents that we collected from people with disabilities are mainly coming from Manhattan. And we're actually expanding the area right now. And hopefully by the end of this month, we'll have a more balanced sample in terms of that. And next slide. And talking about the employment type of the respondents, so 67%, like majority of them are actually employed full-time, but we also have some decent sample from, freelancers and also students. And majority of them think, all their job responsibilities can actually perform remotely. So they don't really have to commute to their office to complete their work. And the table on the bottom right kind of give you an insight of what type of industry our respondents are from. And from next slides, I'm gonna pass it to Arby to talk about the preliminary result that we identified from this survey.
Thanks, Jenny. As Jenny mentioned, we wanted to look at travel trends before the pandemic and during the stay-at-home orders before the reopening of the city, and giving our focus to disadvantaged groups or minority groups and looking at how those trends change from the overall New York City trends. So I'll first go over the travel trends before and during the pandemic, and then after discussing the different groups, we'll have a few recommendations and next steps of what we wish to do with the data. We wanted to look at commute trends. So not just how many people commuted, but also frequency of travel. So we saw that 87% people commuted for work at least once a week before the pandemic. And the mode choice during these trips, we defined it as a primary and a secondary mode. The primary mode is the longest leg of the trip. And the secondary mode is the second longest, which could be like the first mile, last mile connector. For the primary modes, the top three were subway, metro, followed by car and walking, whereas for secondary, we had bus, walking, and subway. And for frequency, you can see that most people, 65% of respondents said that they take the subway or metro at least once a week. And and 43% said that they took the bus at least once a week. Now we'll compare this to the trends that we saw after the stay-at-home orders. So in New York City, as Sarah also mentioned, we had the effect of the pandemic showing around, the shutdown started around 16th of March, and there was an official order from the mayor for stay-at-home orders starting 22nd of March. So we asked people how frequently they're traveling now. And as compared to the previous slide, as you can see, only 12% respondents reported that they're taking the subway or metro at least once a week. And also only around 8% people said that they use the bus once a week. For the mode choice, the trends changed. As we saw in the last slide, it was subway, which was the most preferred before, and now it's walking followed by private car and bike sharing. And we also asked people an important question about what modes they would be comfortable using after the reopening of the city. And most people preferred walking and personal bicycle and private car, which is understandable. They want to social distance and stay away from other people. And just one thing to note here is that you can see that the N is changing the sample size. That's because there were some partial responses and we wanted to capture everything that we could in that survey. Moving our focus now with people with disabilities. We wanted to look at how people with disability faced different challenges or how they were affected differently by the pandemic. One thing that was very interesting we found out is that they had a need to visit their doctors disproportionately more compared to the overall respondents. As you can see, 71% people said that they visited their doctor at least once a week. And that was one of their main concerns as well, that they could not see medical facilities that they used to, and how do they access that during the pandemic. And we also asked them what modes were they physically able to access during the stay-at-home orders. And for people, for the overall population, 32% people said that they could access the subway if they wanted to, whereas for people with disabilities, they said only 9% of people said that they could access the subway. And for bike and bike sharing, the change is even more dramatic, from 24% to 3%. We also looked at the mode choice for people with disabilities. The sample size here is 315. And as you can see, even before the pandemic, the most preferred use for people with disabilities was driving a private car. Around 60% people said that that was their primary mode of travel. And even after the stay-at-home orders, it didn't change much for private car users. It still was at 67% people said that they used it at least once a week. For metro, it dropped slightly, but overall their mode share did not change as dramatically as compared to the overall New York population. This was another question which we asked. This was a ranking question where we asked people what do they look for, or like what would their preference list be when selecting a certain mode. This was, they could rate these 6 different features on a scale of 1 to 6. And you could see that there's some difference between the different groups that we filtered our responses from. For overall New York City respondents, most people before the pandemic said that they prioritize reliability, trip duration. And after the pandemic, it shifted towards health and safety. For people with disabilities, though, they already preferred or like put a lot of importance to safety and health, and it remained the same. We also looked at shifting our focus to another group, minority group, which is low-income New York City residents, which we defined as people who earned less than $50,000 in household income. And from that data set, we removed the students. So for that, you can see that even after the stay-at-home orders, they still prioritize price over health and safety. And that is, again, to say how they are more price sensitive than the overall New York City population. We looked at car and bike uses in New York City as well. We asked people questions about whether they owned a car or they had access to a car. For overall, as you can see, it reflects from the previous slide, as the primary mode for people with disabilities was a private car. So around 89% of people with disabilities responded that they have access to a car. And we asked questions about whether they bought a new bicycle because of the pandemic or since the start of the pandemic, or got a new city bike membership, which is the bike sharing system here in New York City. And for that, you can see that the low income household people said that they did not buy a new bike or have a city bike membership, which is, again, it shows that they have access to less modes. And as you can see from the map on the right as well, which has the household income and different neighborhoods, a lot of the city bike stations also do not service a lot of low income household neighborhoods. So that is another way of showing that they don't even have access to certain modes which other people do. We looked at other trends also, which might have changed because of the stay-at-home orders. We asked people what their how many times they used home deliveries for overall New York City respondents. You can see around 70% people said that they had a home delivery at least once a week, but for low-income household, it was significantly lower at 32%. We also asked people for what reason they were traveling during the stay-at-home orders, because people were asked to limit their trips to only essential trips. And we asked them if they found certain trips more challenging than before. And for the filtered group of people over 60, they said that they found visiting their doctor and going to the drugstore more challenging. And even for the reasons for travel, there was a difference between the overall New York City population. A lot of people said that they traveled for recreation or to get a workout, whereas for older population, a lot of people said that they needed to see their doctor or go to get medicine. Shifting our focus now to women's travel, we wanted to see if women were impacted differently from men because of the stay-at-home orders and the changing landscape. We asked women that about the amount of time they have for themselves after doing household chores, and 32% people reported that they had less time now compared to that they did before the pandemic. This comes from also a literature that shows that women have to, in a family setting, women have to take on more responsibilities with kids and household chores. And around half of the men said that they have around the same times for themselves, or actually have more time for themselves during the stay-at-home orders. We looked at caretaker trips as well, and around 31% people said, women said that they had more such trips to do, whereas for men, they said they had less or same amount of trips to do like that. And this disproportional impact on women is known as pink tax in transport. Based on the data that we collected, we have a few recommendations for a post-COVID transportation system so that we can have a more equitable and a transportation system that's fair to everyone. We want to have increased focus on older people or people with accessibility needs, especially their concerns regarding accessing medical facilities, because we also asked a couple of open-ended questions where a lot of people who belong to these demographic groups stated that this was their main concern and their main fear, that they would not be able to access medical facilities. So increased focus on that. Also improving the frequency of Access a Ride service, which is the paratransit service here in New York City. A lot of people with disabilities say that this was one mode that they were not even able to physically access during the pandemic. So an improved frequency and just making sure that it reaches all parts of New York City would be a very welcome change. For low-income households, again, providing more systemic long-term solutions and more affordable ones as well, because we saw in the data before that a lot of people still valued or prioritized price when choosing their mode over health and safety. And also that a lot of the modes like bike sharing are not even accessible to a lot of these neighborhoods. So having more long-term affordable solutions where they could be given probably free buses or certain other modes which are taken social distance and feel safer in. And for older people who need assistance, provide caregivers and services like probably pair up with volunteers who can help them in times of need. And in terms of next steps, it was a very exhaustive survey. We have a lot more data that we could work with. And we want to also develop a model where we do modeling with the priority scores across different demographic groups. And we also want to see what their opinions are on open streets. And also using all of that, we want to give pointed recommendations for different boroughs and how they're different for different demographic groups. And we are also open to feedback, and this is an ongoing project. And if you have any interesting feedback or recommendations, we are happy to take them.
Thank you, Abhi. Any questions for Abhi and Jenny on the work from the survey? All right, if not, let's pause here. We're a little behind schedule, but why don't we pause for about 10 minutes, take a break, and come back refreshed at 9:50. All right, let's take a break until 9:50. Thanks. All right, everyone. If everyone's back, we can get restarted here with the program. All right, our next session is called Technology and Strategies for a Post-Pandemic World. So here, I think the focus is more on what we can do as researchers and engineers and scientists and planners to move on doing a better job in improving our transportation systems to handle the future of both this pandemic and any future incidents or disasters or situations that may arise. So our first presentation is going to be from Tian Chen and Jian Li from Tongji. So it's entitled Decision Supports of Public Transport Operation Management for Epidemic Prevention and Control of Infectious Diseases. So Jian, do you want to take it away?
Jen, can you hear us? Yeah. Jen, it's your
yes,
turn.
sorry,
Okay,
I mute the...
I know. I always do that in my class. I'm looking at the students and they're looking at me like, look, what's he doing? So I'm mute. So
yeah, we use the Zoom too in school.
it's Jian's turn. I was on mute too. So.
Here you
go. Okay. Okay. So good morning or evening. So this is the work I work with the two graduate students, Chen Tian and Zhang Yimu. So my background is about the hurricane evacuation, but for the pandemic, it's different with the hurricane evacuation. Hurricane evacuation is kind of run fast. So pandemic is like stay at home. So we found that in the for the like COVID-19, the transportation takes a different roles compared with the natural disaster, other like disasters. So because the pandemic is very rare things, so we just want to summarize all these empirical findings and to like incorporate these findings in the current disease support system about public transportation. So this is like a very general background of this work. So the presentation is 4 parts. First is about the research background. So this is a very general picture of like epidemic review in China. They have several stages. So at the first stage is start from Wuhan in the, I think in the late January. At that time, we are very nervous because it's like 1 week before the Spring Festival. It's like a Thanksgiving in United States, but we have like 120, 130 million populations, and also like Wuhan is the central of the China. It's a huge transportation hub. So there was a lot of like mobilities, transfers from Wuhan. So at that time, we are very nervous. And the central government of China, they respond very quickly. So they shut down the cities. You can see that from the pictures. Actually, I think this is the first time in human history to shut down like a city with more than 10 million people in Wuhan. So this controls the virus spread. So at the second stage, so we continuously to control the spread in nationwide, and the third stage is about like a recovery period. So this is the general 3 stage in China. And this is the current situation in China. Like the previous week is the National Day and the Mid-Autumn Festivals. So everything is normal. We have 637 million trips, visitors in the past week. It's like 80%, around 80% of previous year. So this is the situation here. So there are a lot of interesting things. Actually, I just found 5 wedding ceremonies in a morning in a very small places, because in the because they don't have the chance in the first half of the year to have the wedding ceremonies, and this is the long holidays, so a lot of people, they have a lot of activities. So in general, the China is returned to normal. The major motivation for this work is we want to know the role of public transport in the pandemic. As I said, in China, the emergency management process is upside down, the processes. The central government, they can respond very quickly and very strongly to control the virus. But still, they have some problems when they control the virus. For example, the pictures I show here, when they shut down the Wuhan, there were tourists trapped in the city. And also, they suspend all the transit and the local buses. So the patients, and also especially for the doctor and nurses, they don't have they cannot travel. They cannot travel. So if they don't have a car, and also I think in the recovery period, because a lot of people, they choose to drive a car or share a car with their families. So there was a lot of traffic congestions in big cities in China. And also the system here is kind of isolated system. So it's built by the health committee. So they don't include traffic data. We have the data, and also the algorithm and models has not been integrated into the system. So what we want to do is want to incorporate this public transport into this system. We want to use the data we collect from the IC card data, the GPS data, to do traffic operation state perceptions. And also we can use that data to predict the risk of the virus spread, and also to support the travel service, for example, the patients, and for the doctors and nurses, their travels. And the third part, we can make it in the system, Disney Sport system, and to design a system for that. So this is the general description about the needs of epidemic prevention and control decisions. It can be divided into 4 stages: the early incubation period, rapid transmission period, continuous prevention and control period, and the steady recovery period. So each period, they have their decision demand. And also they have some prevention control measures. For example, the detection of infected persons, the blocking the route of transmissions, and the protection of vulnerable groups. So we just summarize all these empirical findings in China, in Wuhan, in Shanghai, and make a table in here. By the way, this is a published work in Chinese version. So we also have an English version. If you are interested, we can share the English version with you. This is the method and the algorithms. This is a big picture about the Disney Sport system framework of the public transport operation and management for a pandemic like COVID-19. We have 4 functions here. So the left up part is about epidemic monitoring. Is basically worked by the health committee, to monitoring and evaluation the stage and the situation of epidemic dynamically. And the left and the bottom part is the case libraries. So it's about like empirical finding, like what we did in this seminar. And this part is about the decision making support. It's all about the decisions about the government, the public, and also the public transport, like companies, what their requirements. And also we all put in the information system here. In this one is like multi-source data fusion libraries. So this is the original one we have from SD card, from the GPS data, all the data. And the multi-source data here is what we collect from the during the pandemic. They have the QR code and also for the information system, grant management system, etc. And we have the data analysis technology library, or the toolbox, to do the monitoring, warning, tracing, evaluation, also for the prevention strategy libraries, also for this four kind of work. This one is about the multi-source data fusion libraries. So we can, based on the data we have, the bus data, the BRT real data, we can make a data fusion work to do a train network trip data, and we can have a person in each day. If they use the transit or use the bus, you can use, we have their trip chain for the whole days. And also for during the pandemic, we also collect the data. For example, in Shanghai or in China, if you go to take the subways, you have to scan this QR code. It can trace you which like a carriage you take. And also we all have like a health code in your phone. So they have three colors: the yellow, green, and the red. The green is
Did we lose John? I think we
can't.
Yeah, I think he froze.
Frozen, yeah.
Okay.
John, you froze. Can you just rewind a minute or so and repeat the slide? Okay, I think he's having a connection problem.
Okay, can you hear me?
Yes.
Is this okay?
Yeah, I think we're back. Okay, go ahead.
Okay. So they have three colors: the green, the yellow, and red. The green one is the health. The yellow one is suspicious, like you have a fever, something. Like the red one is the patient. So we during the pandemic, we do everything with this code. For example, if you go to the shopping market, you have to show them the code. If the green is okay, so he can let you go. It's traced by the telephone data, the cell phone data. So it's automatically. So if you go to Wuhan in January, if you go back to Shanghai, it will automatically change to the red. So that means you go to the very dangerous places. So everyone have to show this one to do anything in China, even now. And also for the data analysis technology libraries, so we can do this work to trace the infected persons and identify close contacts. If you can have all the trip chains for each person, you can know the fellow passengers to take the same buses, maybe the same carriage of the transit. And also, we proposed the six basic technology to monitoring and trace the specific passengers during the epidemic. It's about the monitoring and the tracing. We can do the station flow, the load rate. During the pandemic, the local buses, the load rate is controlled by the 50% of the load rate. We can trace the travel trajectory of infected persons, also for the fellow passengers or ODs, anything. So they can do the combination work of these analysis technologies. And also we can have the prevention strategy library toolbox. You can see from each period, we have the strategy, also have the technical support, and also show you which system support you about this public transport decision making. We make a case study with the data collected in Xiamen. It's an island, a very beautiful tourist city. They have a lot of bus lanes and also have the BRT lines and one subway lines. And we make all the trip chains, the transit bus trip chains. And we matching these trip chains, the accurate rate is around 90%. And we can also see the patterns of all the passengers outside the island, between the island and the inside island, and we can find which part is more risk during the epidemic and propose some strategy to control the risk spread. And also we can trace. I think this is very useful during the epidemic. We can trace each person, which bus he takes, and or is the people take the same bus with him or her. This one, and we can calculate the risk. We can use models. Transmission models of this virus, calculate the risk. And also we can better support the different group of the requirement. For example, for the hospitals, for the doctor and nurses, if we know their travel characteristics during the regular days, so we can maybe can provide them better choices about the travel. And also for a different, it's like a math. So if we know the detailed requirement of the demand, we can propose the better combination of the travel choices. And actually, I think this is very important in the post-epidemic period, because as I said, in Shanghai, the local buses is only 60% compared with the previous years. So that is the most headache for the Shanghai government. So maybe from this system, we can better to reshape the local bus system in the post-epidemic period. And also for the resumptions, you see, I think in the next presentation, Dr. He will show you the customer bus. This is also a very good mode to promote in the post-epidemic period. In general, about the conclusion, I believe that the smart city can play a very important roles during the epidemic and also in the post-epidemic to detection the virus and to predict the virus spread And also, I think most important, in the post-epidemic period, they can to reshape the local buses to change their lanes to short lanes, to provide the small, maybe like small buses, the customer buses, etc. So this is the general description about my presentations. Thank you.
Thank you, Jian. Any questions for Jian or any comments? Again, any panelists can just unmute yourself and weigh in, or attendees, raise your hand and we can open the microphone for you. Or send us a chat if you're having trouble connecting. We can read your question out loud. All right. We'll have time after this too if you think of something, so we'll have some discussion time at the end. Otherwise, let's keep rolling and we'll move on to understanding the intention to commute by customized buses. One of the presentations I was looking forward to. And the presentations, John, is this also you, or is this, I think you mentioned Dr.
No, it's Lin Hui He.
Lin Hui He. So Dr. He, you can take over the screen sharing.
Can you see the screen?
Yes.
Okay. Hello, everyone. Our recent work is related to the intention to commute by customized bus in the COVID-19 recovery period. First, I want to define the COVID-19 recovery period because now we always call the post-COVID-19 period. As we all know, the COVID-19 pandemic has affected regular life of human beings all over the world. China was affected by the pandemic earlier, and a variety of measures were taken to control the spread by Chinese government. According to the development of COVID-19 in China, we defined the time when the government implements strict control measures and the whole society began to resume work and operation as the COVID-19 recovery period. During this period, enterprises were resuming work and production. Traditional commuting by public transportation presented an environment susceptible to the viral infection. Based on the pre-survey or another investigation we made in this period, this led to a decrease in the proportion of commuting by public transport, while that of private transportation increased. The increase in the commuter sharing rate of private transport may cause congestion. Therefore, we want to find a way to not only to reduce the risk of virus transmission, but also to reduce the congestion. As an emergency management strategy, customized bus was promoted in many Chinese cities to prevent cross-infection. A customized bus in the regular period is the rider sharing and demand responsive transit service using bus-like vehicles to operate and serve specific groups of people in a nearby area with similar trip origins, destination, and timing. In the COVID-19 recovery period, you can see the figures showing the customized bus service in Beijing. The service targets the same people in one vehicle, and it guarantees all riders their seats and mutual isolation. The prevention measures were taken for both passengers and drivers. You can see from these two figures, and they were all received temperature checks. To learn about the intention of commuter to take by customized bus in this period, we first conduct a survey in Shanghai, China. The survey was conducted between February the 26th and March 3rd, and issued 467 respondents through the internet. Eventually, 407 valid respondents were collected with complete replies. Of course, the background about the definition of the COVID-19 recovery period and the customized bus in this period was introduced to the respondents. And the survey consisted of 3 parts. First part is about the basic travel information, including the residence place, workplace, and the respondents' main commuting mode, number of commuting days in this period. Second part is about their intention, respondents' feedback on their identification and willingness toward each question from a 5-point Likert square, ranging from strongly disagree or unwilling to strongly agree or willing. Third part is about their personal socioeconomic information. The second part of the survey is shown in this and following slides. As for the aspect of service quality, besides the regular factors such as the vehicle speed, travel time, waiting time, and transfer convenience is here. We also asked the respondents the questions about the health security, like the vehicle hygiene, the temperature in the vehicles. Regarding the subjective norms, we want to learn the impact of the social pressure exerted by friends, family, news media outlets. In our work, in addition to these variables, the social pressure from the medical experts and the government issued policies were also considered. Regarding the perceived behavioral control, when commuters, challenges, and resources restrict them from traveling by customized bus, it impacts their intention. The main aspects of this include living environment, economic conditions, and so on. The number of commuting days in 1 week in this period, as well as the travel restriction measures were added in this part. Finally, the behavioral intention is regarded as the most effective predictor of behavior. In addition to measuring the intention to commute by customized bus at present and in the future, special passes and other enhancements to commute by customized bus for others were also under consideration. As the results of the survey, here we just present the change of commuting mode. As shown in the figure, about 78% of the users did not change their commuting modes, and the number of respondents commuting by car alone, metro, and bus in regular life and in pandemic recovery period was the largest. As for the mode shift, the number of respondents who switched from the metro to car alone driving, from company shuttle bus to lone car driving, and from the metro to family carpooling was large. The results are consistent of the previous investigation we made. It's in the slide 2 we mentioned above. To measure the intention to commute by customized bus, we used the structure inclusion modeling approach, which is SEM. SEM consists of the measurement model based on factor analysis and the structural model based on path analysis. It can test the relationships between the observed variables, latent variables, and error variables in the model. As shown in the figure, the circle is the latent variables which cannot be measured directly, and its corresponding rectangle is the observed variables which can be directly measured through the survey. In our work, the observed variables are the 29 questions we mentioned before. Second, we used a theory of plant behavior for reference to propose our hypothesis. The theory considers the behavioral intention determined by 3 related factors, including individuals' attitudes, subjective norms, and perceived behavioral control. Therefore, we suppose these 3 variables have a positive impact on the intention. In addition, service quality is also related to the intention based on the previous study. We have some reference something. Therefore, 3 more hypotheses are added. Subjective norms and perceived behavioral control have a positive impact on the service quality, and the service quality has a positive impact on the attitudes. The next slides are about some technical problems, and I want to move quickly. EFA, and which is exploratory factor analysis, and CFA, which is confirmatory factor analysis, would run to examine relationships between the observed and latent variables and determine which items were better represented by more specific latent variables. We did this work because we found the service quality latent variable seemed to include different parts. In EFA, the factor loading value of SQ4 was less than 0.4, so it was removed. And the remaining 12 variables used to measure service quality can be attributed to 3 distinct factors based on their meaning. And CFA is used to verify whether the relationships between the variables matched the expectations. Since the coefficient value of SQ8 in comfort and convenience and the PE1 in perceived behavioral control did not reach 0.5, and they were removed. The measured data coming from our survey are input into the model. It is found that there is a certain gap between the index of the initial model and the recommended cutoff values, indicating that the model needs to be adjusted. The adjustment is mainly based on the modification index and the significance level of them. Then we get the final results of the model. This is the final results. And first, we analyze the relationship between the latent variables. Attitudes have a highly significant positive impact on the behavioral intention, and comfort and convenience and public health safety had a significant positive effect on attitudes, while the effect of operation and efficiency was negative, but it is not significant. So we think there's no point to discuss it. Regarding the relationship between latent variables and observed variables, in terms of public health safety, passengers agree that compare with regular bus, taking customized bus can reduce the threat of viral infection transmission, and cleaner and tidier conditions in the bus were also found to be very important. In terms of comfort and convenience, convenience to reach destination and walk to waiting stop was very important in choosing customized bus. Then we perform this work, that is measurement invariance and multi-group analysis, because we think people living at the very beginning, we think that people living in the sub-area and or in the downtown, they might have the different intentions to commute by customized bus. So we performed this work to seek the different groups' intentions. First, the measurement invariance is performed to test whether the variables operated equivalently in different populations, which means whether the parameter results of the structure and the measurement models are statistically the same for different groups. These groups were categorized by gender, age, work and residence place, income, car ownership, commuting mode in regular life and during the pandemic recovery period, and the number of commuting days during the pandemic recovery period. Initial model specifying identical form for all groups split based on social, economic, and commuting characters generates estimates for each group and yielded fit indices that are applied to the entire multi-group model. One constraint is added to the previous level model, and there are 6 levels of invariance model in all. With new constraints added to model, the goodness of fit indicators is become worse. The change in the goodness of fit index is a standard way of assessing the measurement invariance. We used the index is the change of the comparative fit index. When delta CFI for 2 models with different constraint levels is greater than greater than 0.01, the measurement invariance is untenable. Additionally, when the cumulative delta CFI reaches 0.02, the invariance is also unbelievable. In our work, when the model met one of the conditions, the invariance was not accepted. The results show that so what happened? Sorry, could you see the left screen of mine?
We can still see your presentation slide.
Oh, okay, okay. Because my screen has some problems. Okay, no. The results show that age, car ownership, and commuting mode during the pandemic recovery period do not guarantee the invariance. But CFI of the model age is lower than 0.9. It doesn't meet the requirements of SCM, so the further analysis is not made for this variable. Regarding the car ownership versus non-car ownership, we find that public health safety and comfort and convenience had a different impact on the attitudes. Car owners paid more attention to the public health safety of customized bus in the context of COVID-19. Commuters without cars value that customized bus could improve the convenience and comfort, and they were less influenced by new social media. And reducing the risk of infection transmission made relatively less contribution to the latent variable public health safety compared with the other associated observed variables in the group of non-car ownership. These members here. Regarding the private and versus public mode during the pandemic recovery period, the increased comfort and convenience can improve more positive attitudes of commuters taking public transport than that of commuters taking private transport. So I want to make a conclusion. This table showed the outcome or the results to our first above hypothesis limited by the page. I just say some results are different from the previous studies in the regular period. Attitudes had a significantly positive impact on the intention to commute by customized bus, and subjective norms had little impact on the intention to commute by customized bus. This is a little bit different from the previous studies. A lot of scholars made the research and achieved the results as subjective norms almost had no impact on the intention of public transport or something. And comfort and convenience and public health safety had a significantly positive impact on the attitudes, and the operation and efficiency had almost no influence. And multi-group analysis revealed that differences in perceptions among commuters with different characters, including car owners versus people without cars and public transport users versus private transport users in COVID-19 recovery period. Next, we propose some policies according to the results and the conclusion. In terms of the public health safety, issuing the C next one person cannot be taken, limiting the vehicle load rate to less than 50%, placing the disinfectants and masks in vehicles, routine temperature checks, appropriate temperature in the vehicles, proper air circulation should be taken to improve the public health safety. In terms of the comfort and convenience, measures should be taken to optimize the routes and the station settings and better meet the travel needs of commuters. And the possible measures include signal priority and exclusive lanes on expressways. Here I want to explain that in Shanghai, the bus lanes are all the bus lanes are set on the ground road and not set on the expressways. But there are a lot of previous research in this area, so I don't want to explain more. And the improvement measures related to comfort and convenience need to be given priority because of the standardized weight in our model results. And the measures related to public health safety need to be issued considering the effect of COVID-19. Policies also include enhancing the support of relatives, friends, social contexts, medical experts, and government policies, which can increase commuters' intention to use this service. The effect might be small, but it is still significant. The advertising campaigns through traditional and emerging media, such as television, radio, newspaper, and social media, such as WeChat, Weibo in China, and Facebook, Twitter, can persuade commuters to switch to customized bus in COVID-19 recovery period. More specific campaigns can be conducted by advertising public health safety, comfort and convenience of customized buses. Medical experts and government policies can also play an important role informing the public of the advantages of customized buses based on the advice of the medical experts, popularizing the information of virus and the related protective measures directed by medical experts, and other campaigns involving medical experts are the most powerful. Here we try to think, can we combine the two policies, which is the advertising campaigns by the medical experts, maybe the effect will be bigger. In addition, offering special discounts for the fare and selling special pass. These campaigns through external influence can encourage commuters to change the commuting mode voluntarily. And finally, based on the different attitudes, preferences, and identifications of different groups toward customized bus, it is more important to consider the preferences of commuters who own cars or take private transportation in COVID-19 recovery period, and formulate corresponding policies according to their different commuting needs. This purpose of the policies is to reduce dependency on private vehicles and reduce the urban congestion. That's all my presentation. Thank you.
Thank you, Dr. Ha. That was a good presentation. Any questions for Dr. Ha or Jian or anyone from Tongji? Okay, and we'll have discussion time after this, like I mentioned, but let's move on to our final presentation. This is from Professor Azbeh on some really exciting work we're doing here at NYU with using publicly accessible traffic cameras to do image recognition and processing to understand social distancing better. So, Professor Azbeh.
Okay, so can you hear me?
Yep.
Okay, good. So this is the last presentation. So I'm not going to take a lot of time, but just give you some feedback and maybe start some conversation. So this is a group work. I'm just presenting. A lot of the real work is done by students and postdocs and ex-associates. So Fan Zhou is a PhD student. Jingying Gao is a postdoc at C2 Smart. Abdullah used to be a postdoc, but now he works for Ultech Engineers. Hong Yang is my ex-PhD student. He's at Old Dominion University. King Yuma is also at Old Dominion with Hong Yang. So this is a group work. I mean, I'm sure we are missing some names. We have some undergraduate students who are helping us. And again, as I said in the beginning, the idea is to really use some of our existing resources to better understand the changes due to COVID-19. So this was actually the first idea that we had. We said, we want to understand the relationship, the effect of the pandemic. So maybe I can use so I'm becoming a little bit, how do you call it, an expert in this, but somehow my computer sometimes doesn't cooperate with me. Anyway, so I'll use my mouse. So basically, one thing that we would like to understand in New York City, being a very dense city like Shanghai, the relationship between social distancing and urban mobility. We would also like to understand the changes in urban mobility, like how the demand and traffic is changing. And then again, mainly, we want to go beyond understanding what's happening, but also use this knowledge for future similar events and pandemics and so on. And during the same time that we were thinking about this, companies like Apple and Uber and so on, they also started making some data available, and even the agencies in general that are not too open about sharing their data, they started making mobility data and other data available because they understood that people need to know. And in normal times, people are too busy, but now there is a desire to need to know if the streets are too crowded, if subway is too crowded, if traffic is moving, and so on. So here we show a graph of data provided by Apple, and more we started getting this kind of information. So the idea was basically this publicly open data is available all over the place, but the agencies and citizens and students, researchers do not have easy access to these data sets. And some of these data sets need to be cleaned. They need to be somehow filtered and so on. And every research team is doing their own filtering and data management. So we said, okay, let's create a database and a dashboard where we can clean this data, kind of make it more usable, and also generate some basic statistics and reports that are visually easy to look at and attractive, again, for people who are interested, including citizens and agencies and university researchers and so on. We also wanted to see if we can make some improvements to just usual dashboard type of interface, and then add, for example, some unique information that we are extracting from traffic video cameras in terms of pedestrian movements and pedestrian density and so on. So this is actually, I'll talk a little bit more about that. This is the work that Fan Zhou and Jingjing Gao, they did together. Fan is the mastermind behind this. And it's also based on some previous work and knowledge with these publicly available traffic cameras. So here it's the link, so you can go and take a look at it. Some of the publicly available data, which is curated, it's available for download. Some of the more kind of private data, it's not, but of course, under some conditions, we would like to share this data with anyone. So one of the things that we didn't know from the publicly available data is social distancing. So if you look at the figure on the right, you see that even during the COVID time, so this is April, there is people on the street. So people, it's a city, people have to go shopping and so on. And then the picture in the bottom, it's some people during the same time trying to see the hospital ship that came to Pier 90. So that was obviously the time where the COVID crisis was its height, and people were afraid of going out, but see here there's some people who are not. So can we know about this? Can we know about hot spots? Can we know locations in the city where people are getting together, getting too close, and creating these hot spots? So this is an idea that I kind of started with Hong Yang, my ex-PhD student. We were talking, and then Hong was part of my project with AIG 4 or 5 years ago. It's probably you know it, they're very big in China. It's an insurance company. And so we basically suggested that we will use traffic cameras to detect conflicts. So Hong remembered that, and we discussed, we said, can we use the same idea? Can we use this hundreds of traffic cameras in New York City and somehow have an idea about things moving in the city, the distance between people, and then the density of pedestrians and other things that we're interested. And I brought this idea back to our group, and Fan was able to work some magic, and then we'll talk about it. We used off-the-shelf deep learning algorithm with some tweaking, and that worked out quite well. So one thing that I have to tell you, when we did this project 5 years ago for AIG to calculate the vehicle conflicts, in 5 years, there's a big change. So all these neural network, deep learning type of image processing algorithms were there. I mean, people were working on it, but in 5 years, the improvement is so big and then so impressive that the accuracy we get is much, much, much higher compared to 5 years ago. So that's something that and we're hoping that next 5 years, it's even going to get next year or 2 years, it's going to get better. So this is basically our framework. So we have around, I think, 700 cameras in New York City. The image, the feed is publicly available. It's not very high quality, a few frames per second. And I mean, sometimes the camera is not directed to the right location and so on, but you could grab that image from the camera. And that's what we did. We wrote a script. And that was also part of the thing that we did for AIG project. So we can grab the image from the publicly available data feed. We can store it, and we have, of course, it's image data. It's very high storage. And actually, we had a scare, I think, a couple of months ago. Our server was down. Now we are backing it up in the cloud because this is, as I said, in the NSF language, this is perishable data because you want to collect it during the event. And then if you lose it, DOT doesn't save this, then you don't have it. So in some sense, this is very valuable data because it tells us what happened during the pandemic. And then we use these algorithms that I mentioned for object detection using some filters, and then you can calculate pedestrian density, social distancing patterns, and then you can generate heat maps, and also you can generate some real nice real-time depiction of what's going on. So I'm going to click on this. So basically, you could see the number of violations, people walking too close to each other at that location. And you can do that for all the cameras that we are processing. This is offline, but our hope is that in the long run, we can do this online, and you can see a location where it's getting too crowded or the social distancing is violated in real time, and then maybe you can even do some enforcement. Hong and I, we wrote a small proposal to NSF, but we were too late to submit it, so we lost the opening basically for this. So we are collecting data from 100 plus locations in New York City, and then only one location in Seattle. University of Washington is our partner. The problem with other cities and other states, I asked students to look into that, is that most of the other places, these traffic cameras are on the freeways. New York is one of the very few places you have these cameras on arterial city streets, and that way you really can have an idea about the pedestrians, which we are interested, human beings. But Seattle, there was only one location that fit that definition, but other locations, it's all freeways and just cars. And in this context, we're not interested in cars. We are not only in cars, we want to see pedestrians and people. So this is the overall flow chart of our framework. As I said, this is basically grabbing the picture, looking at the frame, identifying the object after some pre-processing and fixing it. And then we tried three off-the-shelf deep learning algorithms, and then we basically looked which one is more accurate, and then we went with YOLO, and I think there's version 4 of YOLO right now. So okay. So here, I mean, one thing that I need to spend a few minutes. So when you do this kind of image processing from a camera that's located at a higher point, you need to have some reference point. And during the pandemic, that's difficult. I mean, in general, the way we do reference point, you send somebody to the field, he measures some landmark. It's like a post here. You see this post. You kind of find its actual height, and then it's further complicated because of the perspective, because when you go further away, objects become smaller. And actually in our previous work, we found out that the higher the camera, the easier it is, because the difference in sizes loses their importance. But here it's not the case, but still it's far away. So Fan was able to build an algorithm that basically puts these little human beings into predetermined boxes and then keeps track of them within that box from the bird eye view with some kind of approximation. And that basically makes sure that we don't need this site-specific measurements. And then we compared, we did some manual validation, and I think this works very well. Actually, we have a recent paper, and reviewers complained that we don't have more validation. I think we have to do that more. But with this simple approximation that assumes that every object, every person that you see is the same height, and the height difference is so small that from this distance it doesn't make a big difference. So we can identify people, put them in boxes, and then find the distances in these boxes to estimate the distance, social distancing between these people. And then you can then generate all these fun stuff. For example, you can find the density per frame of people at certain location. You can look at how the average pedestrian density is distributed. You can look at also number of cases at certain location at time versus number of violations. And I keep saying this in some of these presentations I make here. Actually, we looked at it, and what you see is that the number of cases over time, they go down because people do not do quarantine, and that's how the virus acts. But then you have less cases. So these numbers inside each bubble is the number of cases. So in the beginning, we have a lot of cases. And then you see the social distancing violations, which is the size of the bubble, getting bigger. So here there's an interesting hypothesis, which we still have to try. And I'm working with Fan on that. When the cases go smaller, there is a tendency to violate the social distancing because people feel more comfortable, they go out, there's more people. And of course, it also depends on what is the difference that we are assuming as a social distancing. So this is 12 feet. If you go to 6 feet, it's a little bit less obvious, but still there are a lot of violations. If you do just 3 feet, then it's even less obvious. But so people, the hypothesis is that when the impact in terms of cases become lower, then people start becoming to getting out and violating this social distancing. We can also use the same data that we are collecting to build a hotspot, so you can see what locations at the intersection, for example, you get higher densities. So then you can go and make some changes, put signs, do channeling of the pedestrians so that you kind of diffuse these locations where you have high density. You can change the signals, for example. Maybe the signal timing is too high, too long, so people keep waiting. So you can do that kind of thing using this hotspot analysis. This is what I showed in the small picture. You can basically look at the social distance violations in real time, like dynamically, and then see how it's changing. I mean, visually it's nice. How you use it, it's I mean, effectively, it's a question mark. I mean, one way is people to look at this and then see, what's going on right now in terms of, so instead of trying to just look at each person, look at the graph, and then you see what's going on. Okay, so, and then the last thing that we have been doing, we basically have undergraduate students, we are working with them to basically, as I said, to get more ground truth data and then see what kind of filters we can develop to make the image recognition better, how we can fix the whole thing to get better resolution, because these are low resolution traffic cameras. And also we are using kind of generic training sets. that are available to all the researchers. So we are also creating our own labeled objects to create our training data set specific to New York City. It's not going to be too many, but that might improve our prediction accuracy. So you see some of the filtering things the students are doing and some of the labeling that they're doing. And we are hoping that over this year, we'll get more labeled objects and better filters, and we will improve our accuracy to a level that's even better than what we have right now. So with that, I'm going to stop and I'm going to see if you have any questions.